The reality is if we don't get more and more older workers into our sector, along with workers from other age groups, then we are not going to reach that target of 1 million extra job roles by 2025.
An apprenticeship is a good way of learning because you're supported.
There's a clear benefit for all our service users really. You know, they're going to have workers who are just much more skilled, much more knowledgeable.
You're still out there working, you're getting all the confidence and you're getting a qualification at the end of it.
I think training is really important and I'm a great advocate for lifelong learning.
With record numbers of apprentices taking up careers in adult social care, it is becoming one of the most popular routes into a long-term career in the sector.
Okay, so we're going to hand out some case examples now for you to just consider and just think about these questions, okay?
The overall aim of the project was to support older workers in the sector to access training that took into account their lifestyle and working commitments. The Partners in Care Prime programme took this forward.
One of the reasons we chose the apprenticeship model for the older workers in the ESF project is that over the last 12 months we've doubled the number of apprentices coming into adult social care in England. It's a very popular model because it offers flexibility and it offers on-the-job training, and it's very popular not just with workers but with employers. So it seemed a natural fit for this ESF project to use apprenticeships as a model to support older workers to get the skills and knowledge they need to offer top quality care to the people they work with.
The aims of the ESF funded programme in the South West included helping employers to operate in flexible ways to meet the needs of service users and workers.
As a new organisation, we've obviously recruited a number of workers over the last 2 to 3 years, and some of those staff have been working in social care and have experience, others are sort of newer to social care, and we were keen to provide as much training as we could to all our staff members, and the apprenticeship scheme, you know, appeared to be a really good, solid training programme for a range of our workers.
Come on then, Alex, let's get your bed done. Do we have to? We do.
Some workers had completed a lot of training in their careers, others were newer to social care and needed more structured training, and we selected a group of workers who we felt would benefit from the structured apprenticeship scheme. Often they're a bit apprehensive, but I felt that the information I had on the scheme at the beginning sort of suggested to me that they would receive high levels of support, and a couple of them have gone on to do further training as a result of doing this course.
Chrissy Holmes from Enable Support Services was one of the first to sign up for the programme.
When I started working for Enable Support Services, I felt that I needed to have a little bit more training and a bit more knowledge. So I went to my line manager and she told me about this training that was there for people that were a little bit older.
What did we go and see last time?
Toy Story.
That was it, Toy Story 3.
And you said I was sad.
The training involved going off to college once a month, just for one day. You had lots of help there and there was lots of other people my age there, so I didn't feel intimidated. My involvement in this apprenticeship's been really good. Now I don't have to get my children to help me on the computer, I can do it myself.
For Sue, accessing an apprenticeship has helped her develop new skills and offer more flexible support to people who use their services.
I've had training in health and social care. I've worked in lots of settings in health and social care, but also my late brother had paranoid schizophrenia, and I feel that that's what makes me passionate about the job I do, and probably that's actually more important. This training has involved me going to college once a month, doing homework regularly and committing my time to it. I would like to do more training in the future if we can secure funding for it.
The Ageist at Work also aimed to provide a supported learning environment within a peer group setting and included the support of intergenerational mentors from the Care Ambassador programme. As part of her Care Ambassador role, Christine Moyes from Primacare became a mentor for the Ageist at Work apprentices.
Primacare is a domiciliary care agency. That means we work in people's homes and we support them in their daily living. A lot of our clients aren't actually ill, just elderly and struggle with their day-to-day tasks. So to do that, it gives me a real buzz actually to help them be independent. An apprenticeship is a really good way to learn, especially for older people who have not done any learning for quite a long time. There's always good support with tutors and perhaps even a workplace coach like me. What I liked about it was it really gave me an idea of being able to support people in learning on an individual basis rather than a group basis.
Hey Alex,
Another aim of the project was to help create a dynamic local economy that benefits from the improved engagement and learning of workers who want to develop long-term careers in adult social care.
The most important thing from our point of view as a Sector Skills Council in England is that we're going to share that knowledge that we've learned from the CSF project across Europe with our partners in Sweden, Finland and Poland. As importantly, we're going to share that knowledge with the 40,000 plus social care employers in England who will be able to look at it in their own context and their own setting, but understand in a much better way how older workers can be supported. And the reality is if we don't get more and more older workers into our sector, along with workers from other age groups, then we are not going to reach that target of 1 million extra job roles by 2025 that we're estimating that we will need. So I think it's critical to acknowledge the fact that this ESF funding has allowed us to take a very practical project, get some very good results from it, and be able to share that not just in England, but across Europe.
Being involved in the ESF project has been beneficial to Enable. As a company, it's been really good to work with Partners in Care, and the staff who've done the training have really increased their skills, their knowledge, their levels of confidence. They've enjoyed it a lot.
For those taking part, it has proved to be a life-changing experience.
Being involved in this project has really benefited me. Now I'm going to do my level 3, and that's something I didn't think I was going to be able to do.
I think actually it's made me reflect more on how I've performed and whether actually I could improve the way that I work generally.
This project has benefited me. It's given me a greater insight into the job I do and the people I work with.
Thanks to the support from ESF, they have contributed their skills and knowledge to an innovative programme supporting older workers develop their careers in adult social care.
I think the most important thing to recognise is that without that ESF funding, we wouldn't be able to do this work. And what we've found is that the apprenticeship model is a really good model for older workers. It's a hands-on approach, it's a very flexible way of working, and more importantly, it's worked.
I feel that their flexibility, their pragmatism, the maturity that they've gained through life experience really adds to what they offer as a worker. And I think that all employers should take a positive attitude to employing older workers.